Good day. I'm Timothy Ferdinand B. Romero, your facilitator for today's webinar entitled Interventions with Eating Disorders. Come join me as we tackle the different types of eating disorders, the risk factors, complications, how to prevent and diagnose the said disorders. What is an eating disorder? Eating disorders are mental illnesses that cause serious disturbances in a person's diet. It can manifest as eating extremely small amounts of food or severely overeating. The condition may begin as just eating too little or too much, but obsession with eating and food takes over the life of a person, leading to severe changes. So, kapag kumakain kayo ng konti or marami, may possibility na magkakaroon kayo ng eating disorder. Dahil doon, nawawalan kayo ng control sa pagkakain nyo. Symptoms. Symptoms vary depending on the types of eating disorder. Anorexia nervosa, bulimia nervosa, and binge eating disorder are the most common eating disorders. Other eating disorders include rumination disorder and avoidant or restrictive food intake disorder. Sorry for the inconvenience. Anorexia nervosa, or often simply called anorexia, is a potentially life-threatening eating disorder characterized by an abnormally low body weight, intense fear of gaining weight, and a distorted perception of weight or shape. People with anorexia use extreme efforts to control their weight and shape, which often significantly interferes with their health and life activities. When you have anorexia, you excessively limit calories or use other methods to lose weight, such as excessive exercise, using laxatives or diet aids, or vomiting after eating. Efforts to reduce your weight, even when underweight, can cause severe health problems, sometimes to the point of deadly self-starvation. The warning signs are dramatic weight loss, refusal to eat certain foods or food categories, withdrawal from usual friends or relatives. Health risk includes heart failure, kidney failure, low protein stores, and digestive problems. Here are some pictures of people who has anorexia nervosa. Bulimia nervosa, commonly called bulimia, is a serious, potentially life-threatening eating disorder. When you have bulimia, you have episodes of binging and purging that involve feeling a lack of control over your eating. Many people with bulimia also restrict their eating during the day, which often leads to more binge eating and purging. During these episodes, you typically eat a large amount of food in a short time and then try to rid yourself of the extra calories in an unhealthy way. Because of guilt, shame, and an intense fear of weight gain from overeating, you may force vomiting or you may exercise too much or use other methods such as laxatives to get rid of the calories. The warning signs are wrappers, containers, indicating consumption of large amounts of food, frequent trips to the bathroom after meals, Signs of vomiting, like staining of teeth, calluses on hands. Excessive and rigid exercise routine and withdrawal from usual friends and relatives. Health risks includes dental problems, stomach rupture, and menstruation irregularities. So when you have bulimia nervosa, ito ay episodes kung saan nag-binge ka or kumakain ka ng marami. Dahil din dito, nawawalan kayo ng control sa pagkakain. Kumakain kayo ng maraming amount ng pagkain sa maikling oras. At dahil doon, ginagawa mo nung lahat para mabawasan ng mga nakonsum mo na pagkain. Like through exercise or laxatives. Binge eating disorder is a disorder in which someone eats a lot amount of food at a time, but they don't vomit. When you have this eating disorder, you regularly eat too much food and feel lack of control over your eating. You may eat quickly or eat more food than intended, even when you're not hungry. And you may continue eating even long after you're uncomfortably full. The warning signs are wrappers, containers, indicating consumption of large amounts of food, may be overweight or age and height, may have a long history of repeated efforts to diet, feel desperate about their difficulty to control food intake, and may eat throughout the day with no planned mealtimes. Health risk includes high blood pressure, high cholesterol, gallbladder disease, diabetes, heart disease, and certain types of cancer. With binge eating disorder, from the word binge, with binge eating disorder, kain ka lang ng kain, whether or not busog ka or full ka, kain ka lang ng kain. Dahil dito, may chance na maging dangerous ng health condition mo kasi wala kang control sa pagkain. Rumination disorder is repeatedly and persistently regurgitating food after eating, but it's not due to a medical condition or another eating disorder, such as anorexia, bulimia, or binge eating disorder. Food is brought back up into the mouth without nausea or gagging, and sometimes the food is chewed and swallowed or spit out. The disorder may result in malnutrition if the food is spit out, or if the person eats significantly less to prevent the behavior. Most common in infancy or people with intellectual disabilities. Avoidant or restrictive food intake disorder. This disorder is characterized by failing to meet your minimum daily nutrition requirements because you don't have an interest in eating. You avoid food with certain sensory characteristics such as color, texture, smell of taste, or you're concerned about the consequences of eating, such as fear of choking, food is not avoided because of fear of gaining weight. The disorder can result in significant weight loss or failure to gain weight in childhood, as well as nutritional deficiencies that can cause health problems. To avoid them, we need avoidant or restrictive food intake disorder. This disorder is characterized by failing to meet your minimum daily nutrition requirements because you don't have an interest in eating. You avoid food with certain sensory characteristics such as color, texture, smell of taste, or you're concerned about the consequences of eating, such as fear of choking. Food is not avoided because of fear of gaining weight. The disorder can result in significant weight loss or failure to gain weight in childhood, as well as nutritional deficiencies that can cause health problems. Para sa avoidant or restrictive food intake disorder, iniiwasan mo kumain dahil sensitive ka either sa kulay, amoy ng isang pagkain. At saka ayaw mo masuka or mag-choke. Dahil dito, may chance na humina ka or mag-gain ka ng weight since pagka bata mo hanggang sa paglakad. When to see a doctor. An eating disorder can be difficult to manage or overcome by yourself. Eating disorders can virtually take over your life. If you're experiencing any of these problems, or if you think you may have an eating disorder, seek medical help. Urging a loved one to seek treatment. Unfortunately, many people with eating disorders may not think they need treatment. If you're worried about a loved one, urge him or her to talk to a doctor. Even if your loved one isn't ready to acknowledge having an issue with food, you can open the door by expressing concern and a desire to listen. Some signs that may indicate an eating disorder are skipping meals, making own meals rather than eating what the family eats, withdrawing from normal social activities, frequent checking in the mirror for perceived flaws and excessive exercise. Kung meron po kayong kilala na may eating disorder, don't hesitate na kausapin sila na magpa-treatment habang may chance pa. Kasi pag hindi yan sineseryoso, lalala pa nung condition nila. So, pinakailangan na bigyan sila ng treatment. Causes. The exact cause of eating disorders is unknown. As well with other mental illnesses, there may be many causes such as genetics and biology. Certain people may have genes that increase their risk of developing eating disorders. Biological factors such as changes in brain chemicals may play a role in eating disorders. Psychological and emotional health. People with eating disorders may have psychological and emotional problems that contribute to the disorder. They may have low self-esteem, perfectionism, impulsive behavior, and troubled relationships. Risk factors. Teenage girls and young women are more likely than teenage boys and young men to have anorexia or bulimia, but males can have eating disorders too. Although eating disorders can occur across a broad age range, They often develop in the teens and early 20s. Family history, eating disorders are significantly more likely to occur in people who have parents or siblings who have had an eating disorder. Other mental health disorders, people with an people with an eating disorder often have a history of an anxiety disorder, depression, or obsessive compulsive disorder. Dieting and starvation. Dieting is a risk factor for developing an eating disorder. Starvation affects the brain and influences mood changes, rigidity in thinking, anxiety, and reduction in appetite. Stress, whether it's heading off to college, moving, landing a new job, or a family or relationship issue, change can bring stress which may increase your risk of an eating disorder. Complications. Eating disorders cause a wide variety of complications. Some of them are life-threatening. The more severe or long-lasting the eating disorder, the more likely you are to experience serious complications such as serious health problems, depression and anxiety, suicidal thoughts or behavior, problems with growth and development, social and relationship problems, work and school issues, and death. So, kung meron po kayong eating disorder, ito na pwede mangyari sa inyo. So, dapat alagaan nyo ng sarili nyo. Prevention. Learn the facts about eating disorders. Eat a balanced and varied diet. Don't judge yourself or others on body shape and size. If you think a friend has an eating disorder, say something. Then model positive self-talk. So, para ma-prevent ng pagkaroon ng eating disorder, kailangan mo muna pag-aralan kung ano ba talaga importansya ng eating disorders. Kailangan mo kumain ng masustansya, di ka dapat mag-skip ng meals. Tsaka wag mo din i-judge ng iba sa kanilang weight or size. Dahil kung i-judge mo sila, parang i-judge mo yung sarili mo. Then, kung meron po kayong kakilala ng may eating disorder, i-encourage mo siya or kasabi mo siya na mag-seek ng treatment. Then, model positive self-talk. Diagnosis. Eating disorders are diagnosed based on signs, symptoms, and eating habits. If your doctor suspects you having an eating disorder, he or she will likely to perform an exam and request tests to help pinpoint a diagnosis. You may see both your primary care provider and a mental health professional for a diagnosis. Yung mga tests or assessments para sa diagnosis ay mga physical exam, psychological evaluation, at other studies. Physical exam, the doctor will likely to examine you to rule out other medical causes for your eating issues. He or she may also order lab tests. Psychological evaluation, a doctor or mental health professional will likely ask about your thoughts, feelings, and eating habits. You may also be asked to complete psychological self-assessment questionnaires. In other studies, additional tests may be done to check for any complications related to your eating disorder. So since nasa treatment na tayo, treatment of an eating disorder, it generally includes a team approach. The team typically includes primary care providers, mental health professionals, and dietitians, all with experience in eating disorders. It includes nutrition, education, psychotherapy, and medication. If your life is at risk, you may need immediate hospitalization. For treatment, pwede gamitin ang psychotherapy, family-based therapy, at cognitive behavioral therapy. Psychotherapy, also called talk therapy, can help you learn how to replace unhealthy habits with healthy ones. Family-based therapy is an evidence-based treatment for children and teenagers with eating disorders. Cognitive behavioral therapy is commonly used in eating disorder treatment, especially for bulimia and binge eating disorder. For medications, it can cure an eating disorder. However, certain medications may help to control urges to binge or purge or to manage excessive preoccupations with food and diet. For psychotherapy po, or FBT, the family is involved in making sure that the child or other family member follows the healthy eating patterns and maintains a healthy weight. For cognitive behavioral therapy, you can learn how to monitor and improve your eating habits and your moods, develop problem solving skills, and explore healthy ways to cope with stressful situations. Lifestyle and home remedies to improve your chances of success in overcoming your eating disorder. Try to make these steps a part of your daily routine. Number one, stick to your treatment plan. Don't skip therapy sessions and try not to stray from meal plans. Follow your doctor's recommendations on physical activity and exercise. Talk to your doctor about appropriate vitamin and mineral supplements. Getting most of your vitamins and minerals from food is typically recommended. Resist urges to weigh yourself or check yourself in the mirror frequently. This may simply fuel your drive to maintain unhealthy habits. And last, don't isolate yourself from caring family members and friends who want to see you get healthy and have your best interests at heart. So for the last slide, ito po yung mga quotes relating sa my eating disorder. Just here, nothing tastes as good as healthy feels. And then, the end of an eating disorder begins with the decision to stop. So that culminates my discussion about the different eating disorders. If you have any questions, just write it in the chat box or turn on your microphones. Thank you. If you have any questions, just write it in the chat box or turn on your microphone. Hello, do you have any questions?
May charger ka din.
Who is most likely to have eating disorders? So, the females or girls tend to have eating disorders than males, but that doesn't change that males are also vulnerable to have the disorders. They develop at early 20s or teenage years. After seeking treatment, is there any possibility for eating disorders to relapse? It depends. It depends on the disorder and symptoms. Thus, it requires ongoing treatment and monitoring, like psychological therapy, seeing a psychologist or mental health professional. It can help you normalize your eating patterns and achieve a healthy weight. It also improves your relationship and mood. Are those with anorexia nervosa aware of their current weight and state? Yes, because they don't eat enough because they feel that their problems are caused by what they look like. They have an intense fear of gaining weight because people judge themselves based on their weight. So that's all. Thank you for joining my webinar. I hope you learned something and hope to see you soon. Bye. Thank you for joining.
Thank you po.
Thank you.
Thank you po.